Okay. Hello everybody, my name is Kelly Craggs and I'm the Cancer Lead Nurse at South Tyneside in Sunderland NHS Foundation Trust. So I'm here to talk about personalisation of cancer care today. Now this is where we are. So we are South Tyneside in Sunderland Hospital. We're up in the north east of England. We serve a population of almost 1 million with our acute, community and specialist services. And we have around 3,500 cancer diagnoses per year in the organisation. And that's a picture of our personalised care team there. So personalised cancer care, creating a single point system. So NHS, long-term plan, innovation's critical in terms of delivering that. We know that personalised care has so many positives for patients, but in terms of thinking innovatively, we need to look at the 4C. So thinking about the context, thinking about our national cancer agenda, personalised care is a key feature in that, but it's very difficult to implement when we know how positive it is because of the complexities of our healthcare system. And also we have workforce pressures in our cancer teams. So thinking about how we make a change, thinking about that culture. Within our organisation, we embedded personalisation of care is a key principle of our trust strategy, which raised awareness, it gained a bit of traction, because we want our patients to have a positive experience of care. Thinking about capability, we needed to have a systems leadership approach. Personalised care often involves, a number of people from different sectors, different organisations, and also to have a single point system, we needed to think across our organisation of the systems that we had and the skills and knowledge that we had, tapping in our own resources and using our own workplace technology from a cost perspective. And obviously collaboration, we must work in partnership with our patients. They are absolutely central to this, working with our community staff, our acute staff, and also third sector organisations. So I'll whiz through this. So in essence, this is our model. So we have our cancer information hub here. You're very welcome. We have a poster, put your phone on the QR code and have a look at that. So that's a platform where all of our cancer information is stored right the way from prehabilitation, screening, all the way through to living with beyond cancer for every different cancer type. Holistic needs assessment, many of you may know the challenges around holistic needs assessment, but we have developed a model whereby this assessment is embedded within the patient's healthcare record that is undertaken by the clinical nurse specialist as part of her nursing documentation. She will deal with all of the clinical elements of that patient's concerns, but then those wider needs, those support needs around finances, psychological support, community support, what she is able to do is press a button in that holistic needs assessment digitally, and that will go to our Cancer Information and Support Centre. And in that centre, our staff will pick that up and they will deal with all of the patient's wider support needs. And they will liaise with the clinical teams if they need to. And then what they will do is they will document everything they have done back in the patient's healthcare record, so there's clear visibility for everybody to see to manage that patient's care and provide that continuity. So it fully closes the loop. These are the 3 key elements of our project. So thinking about, our collaborative approach. So, right from the very beginning, we included a number of key stakeholders. We worked with our BAME community. We worked with patients, different ages, different genders. We worked with our staff, and our patients were fully involved in the planning, design and road testing of our model. We wanted to know what they wanted. So, our clinical teams, our workforce, they wanted familiar systems. They didn't want any duplication. They wanted a single point of contact who they could liaise with around that patient's needs. And they wanted something that closed the loop. And our community partners wanted services that were accessible. They wanted good quality, timely information. And our patients, they wanted a model for patients, developed by patients, accessible information and support in a variety of ways. And we see that on the hub. We have videos, podcasts, animations, a number of things, because patients like information in various different ways. So this is our Cancer Information Hub, which we absolutely love. It consolidates everything in one place. We can easily expand that. We've recently seen our Targeted Lung Health Check programme come on board with that. We've had thousands of views from patients, wondering, more information about that if they've been invited to come along. This hub is far-reaching, so I go to my GP surgery, it's up there on the screen, you know, it's on leaflets, you know, it's in GP practice surgeries, you know, we have that everywhere. All of the content, well, the majority of the content is health literacy approved as well. We work with our health literacy team on that. We worked with our BAME International Centre and we trained some support workers within the community to access the hub and to support individuals, you know, within those communities to receive that information. You can switch the information on the hub, which you can have a look at if you have a little look at that on your phone. You can switch it to different languages, which is really, really good. That's just an example there of somebody who had a prostate cancer and the types of areas where they would go right from the point of diagnosis, you know, through to their follow-up care and beyond, and all the different elements of support that they would be able to access on the hub. Measurable outcomes. So in terms of the National Cancer Patient Experience Survey. So we have seen, since this model was introduced, we've seen our results improve and improve year on year. This is the last 3 years' results. You know, we are, there is 8 trusts within in the Northern Cancer Alliance. In 2021, you know, we were 7th out of 8. Now we have moved from 7th in the most recent results up to 3rd in the region, and a lot of those questions that have really lifted our results have been around that personalised care theme, around information about support, so that's really, really pleasing. In the same period, we've seen holistic needs assessments increase by 40% from 2021 to 2023. We've seen our personalised care and support plans increase by 64%, and we've seen referrals into our information and support centre to manage the wider support needs of patients, to make their care really, really personalised. We've seen referrals increase by 90%. We've got a dashboard, so all of this data that we collect, it's accessible, so we've got a dashboard so we know what types of needs patients from different tumour sites may have, you know, what concerns they have, you know, that helps us plan our services, understand areas in different tumour sites who patients might have a different need, so we might need to plan and do something a little bit different for that type of patient. It also helps us look at health inequality. So the map there is all of the patients. That's a map of the city and all the hotspots of where patients are accessing our information support centre. So what we will be doing is laying a deprivation map over the top to make sure that we are hitting the right spots and thinking about different things if we need to, just to try and reduce unfair differences in health. We're able to triangulate our data with National Cancer Patient Experience Survey data and also quality of life data to make sure that we are reaching all of our patients. And in terms of meeting future needs, so, you know, as I said at the beginning, you know, our model is absolutely aligned to our trust strategies. We are starting to adopt and adapt this model across other areas. So we're looking at a similar model in stroke. We're looking at a similar model in the Older People's Collaborative as well. So it's absolutely usable in other areas. We're looking at the same type of information platform, you know, using a similar model for other long-term conditions because it's been so successful. We have shared the model across our Northern Cancer Alliance with our peers. And also thinking about, you know, that role. So we in cancer, we very much refer to our Cancer Information and Support Centre, but actually it's the roles within that who are navigating that patient's care and that wider support needs, that link with the clinical team. So, you know, even if you work in stroke and there isn't a shiny centre, you know, it doesn't matter. The principles of that model is still there. And it's also, you know, this has provided a lot of capacity for our clinical teams to focus their expertise in other areas because they feel assured that patients' wider support needs are being met by other experts, not them. You know, let me deal as a specialist nurse with the clinical needs of that patient and let another expert deal with the wider support needs, but I need to know about it. So it has given capacity to move on to other things. You know, we're now looking at other things to further develop this model, you know, looking at late effects and quality of life, and we're also focusing now on prehabilitation as well. So it's given us that capacity, you know, that headspace for clinical nurse specialists to think, right, what else can we do to improve the care and experience of our cancer patients? Thank you.